Welcome back. Lewis and Peach's Owen Hart Hospital has a new machine. It's called the Flash CT scanner. Dr. Peter Petoniak is here to explain what it is. Good morning.
Wow. Good morning, sir.
Thank you very much for having me.
Happy to.
We are excited about the new technology that Lewis and Peach's Owen Hart Hospital just started to use 2 weeks ago. It is a new CT scanner that is much faster. It can use much less radiation dose when we scan the patient's chests mostly. The reason that Lewis and Peach's Owen Hart Hospital Mother Frances system decided to purchase this machine because it's a new technology, it's much faster, it can image the hearts and coronary arteries of the heart. So then if the quality of the image is good, which this CT scanner provides that, it is equivalent to heart catheterization.
Okay.
Which heart catheterization is invasive test, where the CT scanner is obviously non-invasive test. I think you see some images from the CT scanner where you have a 3D reconstruction of the images of the heart with coronary arteries, and then on the right side you saw reconstruction of the vessel itself where you saw the lumen of the vessel. So if somebody comes with chest pain, and it's not for all the patients, it's more for low-risk patients. If somebody comes with chest pain, usually we do stress test, evaluate a blood work, EKG, and things like that. This machine can look at the heart arteries much faster, and we can bypass many steps in evaluation of the patients. And again, if it is a good study, it's equivalent to heart catheterization, so we know basically the accuracy of the machine is 99%. So 99% accuracy, we can tell you don't have blockages on heart arteries.
Oh, that's great.
Wow. So how is it different than, I guess, and you probably mentioned some of that, than the typical CT scan? There's a little bit, it's quicker, it sounds like it by the name, right?
And more efficient.
Yes, and it has, normally a CT scan has just one source of X-ray, and that rotates around the patient. As the technology advanced, you could initially we just did 2 slices at the same time as cuts through the body, so it had to do so many rotations to scan the heart or any kind of organ we're imaging. This machine does 128 slices, and it has 2 sources, so they rotate around the patient at the same time. So you can image the heart with just a quarter of a rotation of that X-ray tube rotating around the patient. So that's why it's so much faster. And as you know, heart is beating, so you have to somehow stop it, and you stop it by scanning the heart really fast. And that's what this scanner provides, and that's the advantage of it.
Oh my goodness.
And as for radiation dose, everybody's worried about that. We do CT scans and all kinds of imaging, and patients get radiation dose with that. Comparing to all the machine, it's stated in millisieverts, the radiation dose. And the previous CT scanner, when we used it, you were getting 12 to 13 millisieverts. This goes down to 3 to 4 millisieverts.
Wow.
Just to have an idea, just living in Texas, you get about 3 millisieverts of radiation just from the surrounding surrounding environment a year. So you can get this type of image with 3-4 millisieverts. That's pretty amazing.
Yeah, that's really amazing. So who do you recommend is eligible for this kind of scan?
As I mentioned previously, we look at the patients depending on their age, risk factors, and then decide, are you low risk, intermediate, or high risk patient? This is more for low or intermediate risk patients. So you wouldn't do it on somebody who already has known coronary artery disease or blockages or bypasses or stents. You would use it more for middle-aged patients, maybe 40, 50, up to maybe 60, depends on how many risk factors you have.
Absolutely.
Wow, and now back to what it looks for. I know that if I remember correctly, you can have calcification, and you have what is the softer plaque. Is it seeing both, or is it just seeing one or two?
That's a very good question, and I would wanted to mention that too, that with a coronary calcium score exam, which we do that too on this CT scanner, radiation dose is about half what it used to be. You look at only calcification. This scanner actually looks at calcification plus soft plaque too. So it's actually, when you look at it, from scientific point of view, how do you approach a patient in treating them and decreasing risk of heart attack in the future? If you do heart catheterization, you just see a lumen because you inject the dye into the vessel and do X-ray. With this, you can see the wall of the artery. And many times you do angiogram by heart catheterization, they don't seem to have any disease at all. When you do a CT scan, you start seeing a soft plaque that you wouldn't be able to see on a heart catheterization. So it does see calcium and soft plaque.
Very beneficial.
Great piece of technology.
Yes.
Well, thank you so much, and congratulations.
All right,
That's very
thank
cool.
you. Thank you for having